you're on.
Hi, Carissa. I'm Sarah. I'm a nurse practitioner student at Nebraska Methodist College, and I'm here to do your peripheral vascular assessment today. Is that okay?
Yes.
Wonderful. Carissa is a 42-year-old female. She is well developed, appears well nourished, and is a good historian, and her vital signs were normal today. So what I'm going to do first is I'm going to inspect, and I'm going to, let's go ahead and sit you up if that's okay, and I'm going to look at her arms from the fingertips all the way up to the shoulders, and they do appear to be symmetrical. I don't notice any abnormal venous prominence, and again, in a normal clinic situation, Carissa would be undressed and in a gown, and I would be keeping her as covered as much as possible. So again, no abnormal venous enlargement or prominence, and the skin is pink to tan color, normal for ethnicity. And I'm going to do the same with her legs. And I tell you what, why don't I have you go ahead and stand up? And I'm looking at the legs. They do appear symmetrical. I don't notice any abnormal bony prominences. I'm going to look at the other side. And I do not note any abnormal venous insufficiency or venous irregularities on her legs, any varicosities. Okay, go ahead and sit back down. And this time I'm going to have you go ahead and lay down. And her legs appear pink to tan in color, normal for ethnicity. I'm going to look at her feet now, examining the soles of the feet. I do not notice any sores, any ulcerations, and now I'm going to palpate. So I'm going to feel for her radial pulses on both sides. Those are equal and +2. I'm going to palpate her epitrochlear nodes. Any tenderness there? Fantastic. Okay. And I'll do that on the other side as well. Any tenderness there? Okay, okay, wonderful. And the temperature bilaterally is warm and dry. Now I'm going to go ahead and palpate her femoral pulses. I would have gloves on for this, and I'm going to do that bilaterally, so I'm going to go ahead and touch you here and compare them. Those are both +2. Now, if you would bend your leg up just a little bit, and I'm going to palpate the popliteal pulses. That's excellent. It's a +2 on the right leg. Let's do the left. Popliteal pulses are +2 bilaterally. And I'm going to palpate the posterior tibial pulses. Those are excellent, +2. And dorsalis pedis. Those are +2. Now, I'm also going to be looking for hair distribution, and the skin, again, is warm and dry. The temperature is warm and dry, and the hair distribution appears normal. I don't notice any shiny skin. And I am going to, now I'm going to palpate the inguinal nodes. Any tenderness there? Okay. Now, Carissa, I'm going to have you sit up again. And now, what I'm gonna do is an Allen's test, and that would be to test for arterial competence. And I'm gonna have you make a fist, and I am compressing the radial and ulnar arteries. Now what I want you to do is just open and relax it. There, perfect, just nice and relaxed. I'm gonna let go of the ulnar artery, and that pinks up nicely. Now go ahead and make a fist again, and open, nice and relaxed. And I'm letting up on the radial artery, and it pinks up again nicely. Okay, I'm gonna do that on the other side.
Sorry.
You're fine. Go ahead and make a fist for me. Again, compressing both the radial and the ulnar arteries. Go ahead and open and just nice and relaxed. Letting up on the ulnar artery, it pinks up nicely. Another fist for me, please. And letting up on the, go ahead and open, and letting up on the radial artery. And that pinks up beautifully. Okay, now, one more thing we would do to test for venous insufficiency. I am gonna have you lay down one more time.
Okay.
I'm so sorry.
That's
I'm
fine.
gonna raise your legs about maybe 60 degrees, and I'm gonna wait for the venous blood to drain.
Okay.
And as soon as your feet are pale, then I'm gonna have you sit up, and we'll see how much time it takes for them to pink up, okay?
Okay.
And this usually takes about a minute or so. Okay, let's go ahead and have you sit up. And we're gonna let your feet just dangle there. And should take less than 15 seconds, and I notice that they're getting pink again. So that's good. Now I'm also gonna test for capillary refill. In the perfect situation, she would not have nail polish on, but I would press and let up and note the amount of time that it took for the nail bed to pink up. And her nail beds are nice and pink. So that, and they are on her fingers too, and her capillary refill, again, in a normal, perfect world, no nail polish, but noting that it takes 1 to 2 seconds for her capillary refill to come back and her nail beds to pink up. Okay, my dear, I think we're done.
Okay.
Thank you so much for your time.
Absolutely.